Good afternoon and welcome to the WAVY Digital Desk. I'm your host, Sarah Good. Today it's all about Heart Month. So February is American Heart Month. And at WAVY, we are focused on keeping you all in the best cardiovascular shape and health and by giving you these resources. So today we're speaking with Riverside, Dr. Alexandra Ward. She's the medical director of Riverside's Women's Heart Center, and she's going to be with us to sort of maybe debunk some things, to give us some tips and more. So I'm going to bring her on now. Hi, Dr. Ward. Thanks so much for joining us this afternoon.
Hi, Sarah. Thank you so much for having me. It's an absolute pleasure.
Absolutely. Well, you are a resource, for Heart Month now for 2 years in a row at the Digital Desk. So we're so excited to have you back. I think, the first thing that we talk about at WAVY is just, making sure people understand what the risks and signs are, for a lot of these cardiovascular diseases, whether we're talking about, strokes or heart attacks or things that you could be vulnerable for. And a big thing in that, and as you're the medical director of the center there for women's heart health, I think that is such a big focus for us just because the symptoms are not usually the ones that are sort of presented, I think, to the public sometimes.
Absolutely. And I think that's one of the common misconceptions when women particularly think about heart disease and the signs and symptoms of heart disease and heart attack. It's traditionally, everyone always hears about the elephant sitting on the chest, radiating to the jaw and to the arms. And while women do tend to present with those symptoms of chest discomfort, they also have a constellation of other symptoms that they tend to present with, such as shortness of breath, that feeling of hot and sweatiness all over, extreme fatigue out of proportion to what they're doing, back pain, nausea, and vomiting. And so when you put all of that together, it can sometimes be challenging as a patient to say, well, what does all of this mean? What am I experiencing? But that is one of the keys when talking to women, particularly about things to look out for, those signs to really be aware of. And I always like to tell my patients, you know your body the best. So when you think something is abnormal, you know something is wrong, to please call your doctor, your provider right away. Or if you're having any of those symptoms I just described, to go to the emergency department.
And I imagine that's tough for men and women alike. I think, there is this mentality, especially as you're working, if you have families or kids or, you're helping out with friends, of moving through pain, and sort of just getting through the day. You're like, oh, I'm going to push it off later to go to the doctor. But really, if you're experiencing, is it any of these or is it a combination of these that really you should seek out care?
Absolutely. So I would say, really, if you're having, as a man, again, most men tend to have that elephant sitting on the chest. If you're feeling that, definitely need to seek out care. For women, it is same thing. If you get that sensation of elephant sitting on the chest, or even I've had a patient tell me once it was the worst heartburn of her life, and she had never had heartburn before. So things like that, where it's to say, again, it just is abnormal and not something that you're used to having, to definitely seek out care, because especially when we're talking about a heart attack, time matters. Same thing for stroke. It really is, time is muscle, time is tissue. So we really want to make sure that people are getting care early.
And in terms of, that timeline, and I think that is so critical from what you all have told us too, is that, getting and seeking that treatment or getting that help you need, whether it is, eventually maybe even with CPR, if you need extra, hospital care. I mean, that time matters as well, really getting that assistance on scene.
Yes, and we have actually seen that especially women are less likely to receive bystander CPR. And so it's so important that as patients, as caregivers, as providers, and even as community members, that one, we know how to do CPR and that we act quickly, so that if we see somebody who might be having a medical emergency or a cardiac emergency, that we really, one, feel empowered to act, that we know the things to do, and that we are able to act to help save a life potentially.
And going back, before you're experiencing these symptoms, I did want to talk about the lifestyle impact that can sort of have, and I know we'll get to sort of maybe genetics and family, but just your lifestyle. How much of your everyday sort of routines or what you eat or how you exercise, how much of that matters in terms of your cardiovascular health?
It matters very much. So prevention is key. And I am a non-invasive cardiologist, meaning I don't do cardiac catheterizations or put in stents. So I always like to say that's one of the things that I really focus a lot on is that prevention piece of it. And a big part of that is diet and exercise. And so I think sometimes when people hear those things, it can be overwhelming. And you're saying, well, there's all these things out there. What exactly do I need to do? And when we talk about heart healthy diet, we're really talking about those healthy proteins, so like the lean meats if you're a meat eater, heart healthy vegetables, fruits, low fat, and reducing sugar. So those are all things that are going to help with that heart healthy diet piece. And by doing that, it'll also impact blood pressure. If someone is a diabetic, can help reduce those sugar levels and can help reduce cholesterol. And of course, exercise is wonderful for the same things, to help maintain weight or weight loss, to help decrease blood pressure. And it does have an effect on cholesterol and sugar levels as well. So those everyday things we do of, we have to eat every day, and if we can get exercise, even if it is that 10 minutes a few times a day, that adds up and that matters. And I see also on the screen, my little plug too is to really stop smoking, and we know that's hard to do. So there are a lot of resources to help with smoking cessation, but that is one of the key things that can really reduce risk.
And I want to say, we just did a report on the state of tobacco, or sort of, analysis of their report. And one of the big things they said that Virginia actually has improved on is having those services available for people for quitting and having access to that. So, in terms of quitting, that is one positive. If you're looking for those resources, I think they're more widely available for folks now. I did want to ask too, how important is it, again, on the lines of prevention, those checkups, whether it's blood work or understanding that family history?
Those are so important because one of the big things that I always talk about too is knowing your numbers. So one is knowing your risks. So knowing those risk factors that you have that would increase your risk of heart disease. But within that is then knowing those numbers. So you need to know what your blood pressure is, what your cholesterol is, what your sugar levels are. And so having those checkups, and that can be discussed with you and your provider, how frequently they have to be. At least yearly we would recommend, sometimes more frequently depending. But that is so important to know your numbers, because when you know your numbers, you can, one, do things to help improve them if they need improving. And then it also empowers you to say, okay, I know what my risk is. Here's what I can do moving forward.
And I've heard too, at some people's primary doctor, visits, they do EKG. Is that a helpful resource in terms of knowing your heart health, getting that frequent EKG? Or is that something maybe where it could be a good extra, but maybe isn't necessary for each person each year?
So EKG is not necessarily necessary for each person every year. And that is one of those things, again, just talking to your provider to determine if you need an EKG and how frequently you would need it, but it's not necessary every year for everybody.
That's interesting. I know every practice is different, so it's great to have these additional resources available, just in your primary. But I was curious because, it is not always across the board where, it is available or timely, I guess, in that case. And I wanted to talk, you spoke about women, bystanders maybe not giving that CPR or giving that care when needed. I mean, how important, and have you seen maybe an improvement in people knowing those CPR methods, or knowing that they have a defibrillator and knowing how to use that? Have you seen an increase in that at all?
I think we've definitely seen an increase in awareness, and I think that's number one. One is the awareness piece of it, but also people being certified to do CPR, to use a defibrillator. And so I know the American Heart Association in particular does a lot of work around this as well to get people certified. We actually do have some CPR instructors at Riverside as well. And so we have been seeing more people get certified, and seeing, in the classroom, even students learning CPR, and, in college, sometimes at certain jobs, people are doing it. So I think that those are all wonderful opportunities, because sometimes it's hard to get to a CPR class outside of school or work. So we've definitely seen an increase in that, in some of these different settings, which definitely is going to help anytime something were to happen, because again, time is muscle and you never know what you might come across.
Absolutely. And I did want to ask one more thing that, that I guess the world has talked a lot about recently. And I just feel like that is an important piece is stress and anxiety in your cardiovascular health. How linked or codependent are those? I mean, does that have a huge impact on your cardiovascular health?
It definitely does. And interestingly, stress and anxiety play a higher role, have higher risk for cardiovascular disease in women than in men. So it's important for both men and women, but even more important in our female population because we know that those are risk factors for heart disease. Because, of course, as anyone who's ever been stressed or had anxiety knows, it increases your heart rate. It's going to increase your blood pressure. You have that increased catecholamines, which all have negative impact on the heart. So it is so important to really keep a close eye on your mental health and a check on your mental health to see how you're doing. How are your stress levels? What are the things that you're doing not only to protect your physical health, keep your blood pressure under control, etc., but also to help keep that stress under control.
And I know there are medications available for that, but are there, preventative sort of holistic measures that you talk to your patients about? Or what are some of those things that people can do to maybe reduce stress? Because I know you can't get rid of, maybe your family or your job, those are a part of your life. But, are there everyday things that can sort of just help, get you to that next best level?
Absolutely. The biggest things I think are taking that time for yourself. And even if that's 2 to 3 minutes a day, maybe start your day, end your day with some meditation, with some breathing techniques, anything that you do that makes you happy and can help just kind of clear your mind works. So I like to say, just find something that you like to do. I find that those breathing techniques are very helpful. You can do them, even on your way to the restroom, you close the door, you just take those couple of breaths every time you go to the restroom. And that helps throughout the day just to help really kind of calm the senses, calm the mind a little bit, and just decrease that catecholamine surge that we see with that anxiety and stress.
And then if you're at the level of any of these issues where you do need to go on medication, are you seeing there to be more options in the field? Do you see people coming to you more frequently and they're okay with taking medication for different things? I mean, I guess I'm just curious, what's out there and are there a lot of options for, men and women?
There are lots of options in the heart health cardiovascular realm for medications, and I'm sure as people have seen on TV that you keep seeing some commercials for some of the different medications we have as they come out. So one of the things I love about cardiology is there's always research that's going on. There are always new medications coming out. We're always improving our treatment plans, so we do have lots of options. What I would say for certain people is that there are certain people who do need to take medications. And I know some people may be hesitant or say, I'm just not ready for that yet. But we do know that there are benefits, not only in terms of helping reduce those numbers, but also preventing death. And so for those particular patients and those patient populations, we do have lots of options, but it is so important to take those medications because we really can, one, help reduce risk, reduce numbers, but also prevent death.
And I think that's so important for patients to know. I think sometimes, obviously, we know people get scared of going to the doctor, or get scared of the needles, scared of that everyday maintenance. But it's that everyday maintenance, it seems, whether it's the holistic lifestyle adjustments or that medication that seems to make the difference here.
Yes, and I would like to say they both go hands in hand. So those lifestyle changes, those things that you're doing every day really do go hands in hand with medications when they're necessary. And that's so important that it's not just one or the other. It really is that whole change, if you need to make a change or tweak, shall we say, of what we do every day that makes a huge difference.
And I wanted to ask, if you're somebody that does have, maybe cardiovascular problems in your family or heart disease, is that something where you need to get extra tests done maybe earlier on, or are there enough levels, covered by the average, primary care sort of physical?
Well, one, I think it's very important to tell your primary care provider about those risks. So, depending on who the family member is, at what age they developed heart disease, and what the heart disease was, will kind of guide us in terms of how early we do some of those tests, and how aggressive we recommend lifestyle changes versus medications. So that really is number one, is having that conversation with your primary care provider and then determining what is the right time frame. But for those people who have that high cholesterol, especially the genetic piece of that, we're going to want to do that testing early, and we're going to want to be more aggressive about starting medications.
Interesting. So you do need your patient to inform you and to sort of be an advocate for themselves and sort of maybe their history.
Yes, and we always ask and say, do you have any family members who have heart disease? But sometimes people don't necessarily think about, oh, my dad said he had high cholesterol from when he was 20 and had to start taking medications. And so sometimes people don't necessarily correlate that with, oh, wait, that's actually a risk for me too. I might need my cholesterol checked a little sooner.
Interesting. So it's just, being vocal if you can, coming with the information to the doctor. I did want to ask one thing that I had spoken about with the American Heart Association this month that was really a focus for them was heart health and pregnancy for women. That was a huge thing that they wanted to sort of level the playing field, I guess, but the health field for different, ethnicities and minority groups and different races to sort of make sure that everybody is getting the right care that they need and no symptoms, I guess, of cardiovascular health and pregnancy. I mean, can you just speak a little bit about how important that is? I know it's a smaller group, but it is a big problem in our country right now.
Yes, it really is. And maternal mortality, we know, has been on the rise. And part of that is the cardiovascular piece during pregnancy. And so in the Women's Heart Center, it is something that we see quite frequently and something we treat regularly is actually heart disease during pregnancy. So it's very important to understand that any of those cardiovascular complications that occur during pregnancy, which include having gestational hypertension, so high blood pressure, preeclampsia, eclampsia, gestational diabetes, all of those things are risk factors for heart disease later in life. And so that is actually something that we ask our patients about, and we make sure that we are very aggressive with risk reduction in that patient population because we know that that is increased risk. And of course, during pregnancy, really knowing, again, what your body is going through, what you're feeling, and to make sure to seek care early if there's anything that doesn't feel right to you, so that we can make sure that we're seeing if people are having high blood pressure or preeclampsia, so that we're catching them early and can treat them early.
That's interesting. So those, issues that you might deal with in pregnancy then can continue to affect your cardiovascular health later on. So it's not as if, when pregnancy ends and you have a baby that everything is done. Those issues are going to continue to stay with you or be risk factors.
Correct. So they are all those female specific risk factors. And so anytime I have a female patient come in and I ask all the regular risk factors that everyone knows about, I also ask about their pregnancy history. And even, I've had some patients in their 60s say, well, I haven't been pregnant in 30 years. Why are you asking me about this? So, it really does matter. And we're seeing more and more how much the impact of pregnancy has long term.
Wow. And before we wrap up, I know we're just about out of time. I just wanted to ask, are there any, top tips or myths that you sort of want to break down that you see a lot with patients when they come in, or just anything that sort of we can last as like a highlight for people to know?
I think the biggest thing for people to know is really, again, know your risk and know your numbers. And I have seen a lot of people say, oh, just give me 6 months. I'll get this down. I'll get this down. And while that sometimes does work, sometimes if we see numbers that are high enough, it's so imperative to really start that medication early, because that's really how we can help reduce risk. So I know sometimes it's scary and people don't want to do it, but it really does make a huge difference.
Well, Dr. Ward, thank you so much. And I did want to mention as well, there is an event coming up at Riverside during Heart Month. Can you tell us a little bit about that?
It's February 15th at 6 p.m. It's an evening with Riverside Cardiology, where we'll be talking about heart health. I'll be speaking about women's heart health, and we have a few other cardiologists talking about some kind of high yield topics in cardiology. So it should be a great time. Everyone is invited to attend.
That's great. So, if this did not answer all of your questions, I know we only had 20 minutes. Go to that event on Thursday, right after Valentine's Day. So a week all about hearts in different ways. but, go to the event and sort of get those questions answered. Well, Dr. Ward, thank you so much for joining us this afternoon. That was super helpful. And I think, really interesting and great reminders for people sort of in their everyday routine to take time for themselves, know their numbers, not be scared of the doctor, I think is always a big highlight from these conversations, and just understand what's happening with their body.
Yes, thank you so much for the opportunity, Sarah.
Absolutely. And thank you to everyone joining. There will be an article on WAVY.com where you can find out more about Riverside's Women's Heart Center, and also, find out more resources during American Heart Month to keep you safe. Well, thank you, Dr. Ward.